This is Dr. Calvin Ezrin, resuming our conversations regarding the proper treatment of overweight with or without diabetes. Recently there have been reports about the superiority of surgical treatments for the management of what has been called morbid obesity, with people who are greatly in excess of the average normal weight. And the weights of 250 to 400 are included in this group. Now, surgical treatment can be divided into two categories. One is called lap band, which is a simpler procedure that involves putting an injectable band around the stomach. This can be done laparoscopically, that is with a keyhole incision. And then there's another one called intestinal bypass surgery, which the stomach is bypassed to a lower part of the intestine to limit the amount of food that's absorbed. And both of these, the results are quite dramatic. The weight loss is quick and it's also sustained. Whereas the alternative medical treatments that were put up for comparison don't have the similar effect. They're slower, and ultimately when they do reach whatever they're going to achieve in the way of weight loss, it's never lasting. So what is the reason for this? Well, it's probably because the proper treatment of medical obesity, that is without surgery, has not yet been discovered. And I think that it's important to know that there has been experience, even though it's not easy to document because it's more complicated to bring about. But medical treatment can do as well as the surgical approaches, and even in terms of long-lasting effect, it can also match them. I can give you my experience over the years that I've worked with this increasing understanding of what's going on in obesity. There are a couple of abnormalities mentioned earlier. One is that there is an important role of insulin. And insulin has the power to, by increasing your weight and through fat production and actually contributing to the resistance to insulin itself, so that it's a vicious cycle. You gain a little weight and then you need more insulin, and then that makes you fatter and then you need more insulin. Ultimately, insulin can make you diabetic. The second one has to do with the most important brain chemical called serotonin. And serotonin is depleted by stress, and it shows up in that depletion with two important symptoms. One is that people have difficulty controlling their carbohydrate cravings. They get hooked on comfort foods and become, in effect, almost a carboholic, because that's the way they can temporarily get their search for serotonin satisfied. But there's also another issue here, and that has to do with the amount of energy and the amount of sleep that they're getting from that energy. Sleep is something that has been an important part. Sleep deprivation has been an important part of weight gain for many years, but it's never been properly addressed. There is a special medicine that I've been using over the years, which I've alluded to earlier in my talks, called trazodone, which carries with it in its molecular structure a small amount of serotonin, and it gives a jump start of serotonin to the sleep at the time of going to bed when you take it. And this jump start of sleep is translated into a good level of deep restorative sleep that's been missing over the months or years, and then finally you build up over repeated good night sleeps. You'll get back the serotonin depletion that has been caused originally by stress. So the combination of a low carbohydrate diet, properly supplemented by trazodone, which gives you the serotonin that's required to build up your deficit, will give a weight loss that is steady and is supportive with the proper amount of medication. And ultimately, when the effective amount of weight has been lost, it will stay off. And furthermore, when further trazodone administration is given for a few more months, it can then slowly be withdrawn, on the assumption that if you don't have a breakout of cravings or daytime fatigue, then you have replenished your serotonin sufficiently so that you won't need it anymore. There's no addiction and no dependency because of this safe medication. So this is the end of the brief talk today, and we'll cut it off here.